Hello everyone, I hope you are having a good day wherever you may be and whatever time you're watching this video. In this video, we will be going over the Sepsis Shield study. The full name of the clinical trial is Host-DX Sepsis in the Diagnosis and Prognosis of Emergency Department Patients with Suspected Infections and Suspected Sepsis. So first, let's talk about what sepsis is. Sepsis is a life-threatening medical condition. Nearly half of all in-hospital deaths are caused by sepsis. During sepsis, systemic activation of the immune system by the presence of bacterial, viral, or fungal infection in the body causes a severe and prolonged release of inflammatory molecules into the bloodstream. And patients with sepsis are more prone to coagulation and leaky blood vessels due to mechanisms of the body's inflammatory response. And blood clot formation can then block blood flow and therefore oxygen and nutrients from reaching the organs. The widespread inflammatory response in the body can also cause systemic vasodilation or a widening of the blood vessels, which can lead to a drop in blood pressure. The drop in blood pressure could also be caused by the leaky blood vessels. And in severe sepsis cases, patients may experience single or multiple organ dysfunction. Severe sepsis may also progress to septic shock, which occurs when blood pressure falls to the point of causing inadequate blood flow to organs and can result in multiple organ failure, which could lead to death. So what are the signs and symptoms of sepsis? The symptoms include fever or low body temperature, tachycardia, which is an abnormally rapid heart rate, hypotension, which is low blood pressure, altered mental status, which is confusion or disorientation, shortness of breath, which can be described or indicated by abnormally rapid breathing. And these symptoms are mentioned in the Sepsis Shield inclusion criteria, and I have bolded them in this slide. Other symptoms include pain or discomfort, fatigue or weakness, clammy skin, low or high white blood cell count, and decreased urine output. So where do infections that can lead to sepsis commonly start? Pneumonia or infection of the lungs is a common cause. Pneumonia is an inflammation of the lungs due to infection and can cause fluid and pus buildup in the lungs. We also see infections of the organs of the digestive system, like the stomach and the colon. Other common organs include those of the urinary system, like the kidney, bladder, and urinary tract. Skin infection is also a common cause of sepsis. Now let's discuss who is at risk for sepsis. Folks who are 65 or older or younger than the age of 1 have higher risk for sepsis. Another group that is higher risk are folks who have weakened immune systems and have chronic medical conditions like diabetes, lung disease, cancer, kidney disease, and heart disease. And patients who have had sepsis before are more likely to get sepsis again than others. Okay, so I hope that all of this background information will help you screen for potential sepsis patients for the Sepsis Shield study. Let's move on to the Sepsis Shield study itself. The purpose of the Sepsis Shield study is to evaluate the diagnostic efficacy of a test called the Host-DX Sepsis. This test was produced by the molecular diagnostics company Inflammatix. And this company aims to develop rapid tests that read the immune system to help physicians determine the presence of infection, whether infection is bacterial or viral, the infection severity, likelihood of developing sepsis, and the need for antibiotics. The more prevalent current use of assays tests for pathogen presence in the blood, and those can miss infections that haven't spread to the bloodstream. The Host-DX Sepsis assay, which instead reads the immune response to infection by measuring the expression of multiple immune genes, would help emergency department physicians determine the severity of infection as well as whether or not to prescribe antibiotics. And this study is an RC study. Research coordinators and investigators can obtain consent, and consent is also available in the foreign languages. Next, let's go over the inclusion criteria. There are 3 criteria that need to be met, but the second one can be satisfied in 2 ways. First, the patient must be greater than 18 years old. The second criteria can be satisfied if either of the following are true. The physician suspects an acute infection, and you will be able to check whether the physician suspects acute infection in the notes section in EMR, as well as the comments on the track board. And RAs could also talk to the physician to confirm suspected acute infection. The second way to satisfy the second criteria is if you see that the patient is suspected to have sepsis. Again, RAs can check the doc comments on the track board, the notes in the patient's chart, or check in with the physician themselves. And in the study, suspected sepsis is defined by a blood culture order by the treating physician, and if 2 of the vital signs are at the values indicated in Table 1. So looking at Table 1, we see a lot of the symptoms discussed earlier. So we have heart rate greater than or equal to 90 beats per minute, temperature above 38 degrees Celsius or below 36 degrees Celsius. For respiratory rate, there are 3 options that can be met in order to meet inclusion. The breathing rate being greater than 20 breaths per minute, or the partial pressure of oxygen in the blood being less than 60 millimeters of mercury, or the oxygen saturation being less than 90%. Moving on to systolic blood pressure, that vital sign can meet inclusion if it's below 100 millimeters of mercury. And the vital sign in Table 1 is altered mental status. In the notes, you can look for an ANO times 3 or less, or GCS of less than 15. And remember that in addition to the blood culture order, only 2 of these vital signs must be at the indicated values in order to meet inclusion for criteria 2. And the third criteria is the ability to provide informed consent, or the ability of a legally authorized representative to provide informed consent instead as a surrogate. Now let's go over the exclusion criteria. So if the patient reports treatment with antibiotics, antiviral agents, or antifungal agents within the past 7 days prior to ED visit, they are excluded from the Sepsis Shield study. Note that patients would not be excluded for receiving antiviral treatment for HIV infection, hepatitis B and C, and other exceptions are for topical antimicrobial agents, prophylactic antibiotics used for preventative treatment, and if only a single dose of antibiotics was used during the present ED visit, if it is less than 6 hours before the blood draw. Other exclusion criteria are patients receiving palliative or hospice care, or those receiving limited interventional care, prisoners mentally disabled or unable to give consent, and if the patient cannot provide informed consent, the legally authorized representative can provide consent on behalf of the patient. Sorry, that's my roommate's cat. Patients receiving experimental therapy or who are already enrolled in a clinical trial are also excluded. Patients previously enrolled in the present clinical trial. MRAP's role in this study is to screen for eligible patients based on the inclusion criteria and to notify the research coordinator of potential subjects and assist the research coordinator with enrollment. The inclusion criteria will be mostly found within the patient's chart in EMR. So how do you know whether you should click into a patient's chart? Remember that we only want to be accessing protected health information if we believe the patient may qualify for the study. This way we are following HIPAA. Sometimes on the EMR track board, you will see a patient presenting with a chief complaint of sepsis in the chief complaint column, or that the physician suspects sepsis in the doc notes column. But other times, suspected sepsis or acute infection may be less clear. In these cases, the background information on sepsis discussed earlier and the inclusion criteria may be able to help. For example, if you see on the EMR track board a 75-year-old patient coming into the ED with a chief complaint of a urinary tract infection or a fever, and then you check the laboratory orders on the track board for this patient and see that a blood culture has been ordered by the physician, then you could consider clicking into this patient's chart in order to screen them further for Sepsis Shield. Regardless, the research coordinators are always there to answer any questions and discuss things further. So don't be afraid to ask them for their opinion or for more information, especially since this is a new study that MRAP is not yet familiar with. All right, so that concludes the overview video for Sepsis Shield. I hope that was helpful, and have a great day.